So this is chapter 36, Substance Use Disorders and Infectious Disease. Why is infectious disease such a common complication for people with an SUD? So we have sterile technique is rarely used. The circumstances under which IV drug use occurs virtually guaranteed infections. You also have contamination reasons. So illicit drugs are often contaminated with various microscopic pathogens. Needles are not properly cleaned before or between uses, and needles spread viruses that cause hepatitis, HV1, syphilis, and even malaria. Assorted bacterial infections seen in individuals using intravenous drugs. Infective endocarditis, when bacteria infect the valves in the heart. 15 out of 100,000 in general population, 1 in 500 among IV drug users. You also have skin abscesses, necrotizing fasciitis, subcutaneous tissues attacked by bacteria normally found on skin surfaces. Special danger to cocaine users. The pneumonias, acute infection of the lung tissue normally caused by bacteria or fungi. Fungal pneumonia, common complication of IV infections and of heroin use. Aspiration from ammonia, dangerous material enters the lung during regurgitation, creates a growth medium for bacteria. Community-acquired pneumonia. Many are hospitalized, can be fatal. A vaccine exists to provide some level of protection. Tuberculosis, one of two. It is one of the oldest known diseases, has killed over 1 billion people over time. What is tuberculosis? It is caused by several strains of a common bacterium. Other factors: intensity of exposure, poor health and malnutrition. Genetic predisposition. How is tuberculosis transmitted? How does it kill? TB kills by invading the pulmonary systems and can also infect virtually every organ in the body. The treatment of TB. It can be treated with a number of antibiotics, but treatment-resistant strains are emerging. About 18.7% of those with TB also had a substance use disorder. Patients with an SUD are less likely to take medications properly, contributing to the overall problem. Could one day reemerge in plague-like levels. Acquired immune deficiency syndrome, so AIDS, 1 of 6. A short history of AIDS. What is AIDS? Not a disease, but a syndrome that causes the immune system to break down and function inefficiently. Where did HIV come from? A jump from primates to humans around 100 years ago in Africa. The scope of HIV infection. 36 million worldwide, 1 million deaths each year. Around 1.2 million patients in the United States, many of whom are unaware. Pediatric AIDS. 7th most common cause for death of children and adolescents. Passed to child at birth through sexual contact and experimental IV drug use. How does AIDS kill? HIV infects the very cells sent out to the body to destroy it. HIV-1 can remain asymptomatic for 10 years plus. In 20% of the cases, the development of an opportunistic disease is the first outward sign of HIV infection and is often the cause of death. HIV-1 has many ways of outsmarting the immune system. The chain of HIV infection. Male-to-male sex is most common form of transmission in the United States. Unprotected heterosexual intercourse is the second most common. Sharing IV needles, about 40% of IV users are infected with HIV. Less common is vertical transmission, infection of baby during childbirth. Life expectancy for people with HIV-1 infection. HIV-infected person is thought to lose 10 years of potential life. Those with HIV and SUD lose approximately 20 years of potential life. The small number of people have bodies that fight the infection to a standstill. The treatment of HIV infection. Nutritional status. HIV IV drug users often have inadequate nutrition. Antiviral therapy. It slows but does not eliminate replication of HIV. As a high cost is a treatment barrier. AIDS and suicide. Individuals may be 3 times more likely to commit suicide as high in those receiving treatment. Period of greatest risk is right after recognition of infection. AIDS and neurocognitive dysfunction. Asymptomatic, minor neurocognitive defects, HIV-associated dementia, HIV and employment, HIV and mood disorders. Viral hepatitis. Inflammation of liver, hepatitis A virus, method of transmission, exposure to infected feces, needle sharing. Syndrome induced by HAV. 1% of cases developed acute liver failure, more common in older adults. Consequences of HAV infection is relapsing hepatitis. Hepatitis B virus. Method of transmission. 100 times as contagious as HIV. Can live on the surfaces for more than a week. Transmitted by toothbrush, razor, IV drug use, sexual contact, even kissing. During childbirth from mother to child. 22 million new cases a year due to needle sharing. Consequences of HBV infection. 90 to 90% recover completely. Acute live liver, I'm guessing is what it's supposed to say, is liver there. But acute liver failure in less than 1%. 20 to 30% will develop cirrhosis or liver cancer. Treatment of HVB infection prevention. So hepatitis C virus mode of transmission. About 3.9 million are affected in the United States. About 45% are attributed to IV drug use. Consequences of HCV infection. About 20% will overcome in 6 months and be virus-free. And others slowly destroys liver over 20 to 30 years. Alcohol and or marijuana users experience increased progression through stages. Treatment of HCV infection. So that's it for this slides. Thank you for watching.